Local health officials are beefing up measures to prevent the entry of the COVID-19 variant first found in India. This variant is believed to be killing thousands of people in the South Asian country. But how dangerous is this so-called double mutant variant? Well, we now talk to infectious diseases specialist Dr. Edsel Salvaña. He's also a member of the DOH Technical Advisory Group. Good morning, Dr. Salvaña. Thanks for taking our call.
Good morning, Ria. Good morning to everyone who's watching.
Now, doctor, is there any indication at all that this variant, this double mutant variant first found in India, is now in the country?
Right now, we're actually still doing our genomic surveillance. As you may have heard, there is that ship that is anchored currently in Manila Bay that came from India, about with positive crew members. They were actually initially diagnosed in Vietnam, but they were not allowed to disembark. These are Filipino seafarers. So actually, right now, DOH is monitoring them, and the genomic surveillance on those passengers is being done. So we'll find out soon. But they are all quarantined. There's a few of them in the hospital under full isolation. And of course, we continue to monitor patients who have history of travel from India, just to make sure that these don't spread in the community.
Now, if ever this double mutant variant does get to the Philippines, how will this affect our healthcare system? And what actually do we know about this double mutant variant? Is it as contagious as the UK and South Africa variants, and could it be more deadly?
Right. So this variant was first discovered in India. It's called B.1.617. And it does have some features in common with the UK variant, where they actually did see the N501Y mutation, which is associated with increased transmission. But it also has its own unique mutations, which are very similar to the South African variant. There may be some decreased binding for antibodies, and these are the L452R and the E484Q. Right now, so they're still investigating. It's what we call a variant under investigation. But WHO and a few scientists have already said that this is behaving like a variant of concern, which is similar to the South African variant as well as the UK variant. And also, the concern is with the surge in India. With so many patients getting COVID, it actually gives the virus even more chances for mutation. So on top of the fact that this mutated form is already circulating in India, it can actually acquire even more mutations. And so this is very concerning, and we're monitoring the situation very closely.
Doctor, do you have any updates on the other variants that we know are already in the country? Now, I know we need to expand our capacity to be able to actually sequence more samples, but would you say that the UK, South Africa, and Brazil variants are continuing to spread, and are they the most dominant variants that are out there now?
Well, right now we know that there are more cases of the UK and the South African variant circulating in Metro Manila and even some parts of the Philippines. It's very difficult to say what proportion, because what we're doing is we're sequencing samples of people who are, in big clusters. And so you don't actually get necessarily a representative sample. But we do know that the number of cases is increasing. The Brazil variant, P1, there's been only 2 cases, and we haven't detected any further. So for now, fingers crossed, that hasn't gotten into the community yet. But certainly, South African and UK variants are concerning. The P3, which was first discovered in Cebu, seems to be stable. So that's really more acting as a variant under investigation and not yet as a variant of concern.
All right, well, there is more good news. We see numbers going down, especially here in NCR. That being the case, and if that trend continues, would you be in favor of further easing restrictions?
Well, we've always said that the most important parameter here is the ability of our hospitals to take care of patients who are sick, because a person with severe COVID if properly taken care of, has about a 5 to 10% mortality. If you don't have the right facilities, that can go all the way up to 100%. That's what we're seeing in India right now, where the healthcare facilities are overwhelmed. So it's a two-pronged thing. We know the cases are going down, and that's good. But you still have, even if it's going down, proportion of those will still be severe COVID, and they need care. So we have to make sure that we have enough hospital beds to take care of everyone, because it's inevitable. If you open up, you're going to see more cases. Hopefully, we adhere to our minimum health standards so that the increase in cases is manageable, but it goes from both sides. We have to keep cases manageable, and at the same time, we have to have the healthcare capacity to take care of these patients in case there is another surge.
That's right. Always that delicate balance there. Thank you so much for your time this morning, infectious diseases specialist, Dr. Edsel Salvaña.